Okay, so now we've discussed both what compartment syndrome is, where it tends to occur, some of the underlying anatomy that predicates it, sets you up for compartment syndrome, and we've also talked about 6 commonly recognized causes of compartment syndrome. I want to devote this video segment to how does the patient feel when they're developing compartment syndrome? What are the things that they ought to be on the lookout for that could let them know that they've got a serious problem on their hands? Well, the first and foremost cardinal symptom of compartment syndrome is pain. So the affected limb, where the fluid is developing and accumulating, that limb will experience pain. And there is a certain kind of hallmark of the pain associated with compartment syndrome. It's commonly written in medical textbooks that the pain will be disproportionate with what is seen or what is evident. So the patient will be in even more pain than what can be explained by the physical findings that the medical provider may be able to determine. So that's your first tip-off, is that there's pain, and that the pain oftentimes is severe. It's disproportionate to the evident injury. The second symptom that a patient who is suffering or developing compartment syndrome may experience is paresthesias. Paresthesias are basically numbness, tingling, and other inappropriate sensations that may develop in the affected limb. And that's because as the nerve starts to get choked off inside of that compartment, the nerve begins to malfunction, and that can cause various abnormalities of sensation. The most classic is something we call paresthesias, numbness or tingling. A third symptom that a patient may notice as a result of the development of compartment syndrome is that that affected limb, whether it's an arm or a leg, can become pale, it can start to look blanched, and the pulses that you would normally feel, for example, a radial pulse or a popliteal pulse behind the knee, those pulses may either become diminished or become completely absent. And then as the compartment syndrome continues, the final symptom that I want to talk about, it's perhaps the one that's most delayed and obviously the one indicative of the most devastating injury, is actual paralysis. So as the compartment syndrome continues to worsen, as the fluid and inflammation that's accumulating within a compartment continues to progress, there is nerve injury, there is muscle injury, and there is compromised blood flow that eventually results in complete paralysis of the affected limbs, so that they can no longer use that arm or they can no longer use that leg. By the time this particular symptom develops, the horse is well out of the barn and there may be serious underlying permanent injury.